Well, hi, everyone. I'm here today to give you just a little bit of a rundown and a quick summary of the standardized patient case involving the upper extremity, in particular the shoulder. My name is Aaron Shasha, and I'm going to take you through some quick details. Really, as far as this particular case goes, this is a lifespan case, meaning that this is a situation where you have an individual who participated in athletics last time about 10 or 11 years ago, and now in his late 20s is having some issues with his shoulder. And so the issues, unfortunately, are affecting his job. And there's a number of layers of complexity to this particular case. Not so much that the diagnosis in and of itself will be a challenge, but more so of how it is impacting him as an individual and impacting his family. This particular individual has a family history of arthritis. He clearly has, at this moment in time, a family to support himself. And then also his spouse, his job is being limited or threatened, if you will, because it's hours based and the hours are being cut. And so his inability to perform his job means that then he cannot get paid, and now they're in a financial bind. And so in essence, this is what I would chalk up to a life after athletics case. And so we see these quite common in the clinical world, and this is certainly something that we need to prepare, future clinicians for. Now, as far as curricular content, there's a number of standards that could be met with this particular case. The effective communication component that we see quite often in the standards, using the International Classification of Function, performing the physical exam in and of itself, formulating the diagnosis, and then, of course, if warranted, based on what the student ends up concluding, is that could be a referral opportunity. And so pulling all those pieces together will enhance their skills, but at the same time get them ready for the challenges of the clinical world. Now, the upside to this particular case is that A, it's not very common, but B, this is something that you can modify and tweak, for the advanced learner, or, if you want to just switch it up a little bit amongst, even the same level student. The case can be modified to use different grades of injury. In this particular case, because it is in a acromioclavicular joint problem, there are different grades and classifications of that particular situation. In this case, it's been tailored to the Rockwood system. But this is certainly something that can be used with other classification systems as well. I'll get to that in just a second. But as far as the different grades, technically, the higher you go, the more severe the injury is going to be, which means that you're more than likely going to end up in a situation where referral is definitely warranted. And this might be something that is going to require some level of reconstruction surgically. Lower grades, from what the one that is set at the moment, tends to go a little more conservative. And so the evidence tends to be down the line of using more conservative measures for your lower grade situations, your grades 1s and 2s. 3 is a little convoluted, and I'll explain that here in a second. And then your 4s, 5s, and 6s tends to be ones that get operated on. So those could be switched up if you are teaching students in that manner. Now, the convoluted part of the type 3, this is something, unfortunately, that has been a large debate in the literature for quite some time. And where this can be modified, if you want to get away from the Rockwood system, and it's not an insult to the Rockwood system, it's just there are other systems out there to classify these types of injuries. One of those comes directly from the organization known as ESICOS. They came up with a classification system where they actually subclassify type 3 injuries from the Rockwood system to 3A and 3B. And then the 3A and 3B situations really become more of a dynamic functional component, where there is either the presence of scapular dyskinesis as a result of the injury, or there could be a lack thereof. And so when there's a lack of dyskinesis, you tend to treat this more conservatively. When there is dyskinesis, you start with the conservative, and if the conservative fails, then we start to suggest maybe surgery is an option. So you can take it that direction too, if you so choose. So all that being said, I think this is one of those injuries that not only is seen quite often in athletics, but it is seen as, unfortunately, having consequences down the road once we get away from that realm. And I think that this is certainly a case that you can not only have some fun with, but at the same time, I think you can challenge your students a little bit. So please take it, and hopefully it gets you to where you want to in regards to your learning outcomes.